Welcome back. Do you go through every day with some kind of pain? Do you simply ignore it, try to relieve the pain, or does it stop you right in your tracks? Well, many people out there deal with real pain each and every day. Today we're joined by Dr. Rodolfo Gari from Florida Pain Relief Group to talk about what they do. Welcome to the show this morning.
Welcome, Steve.
So tell me a little bit about what Florida Pain Relief does for patients here in the Tampa area.
Well, sure. Florida Pain Relief Group is a group of physicians that specialize in pain management. Pain management is a subspecialized field of anesthesiology and other fields where all that we do is take care of people that are in pain.
And can you deal with some of those types of pain without having to resort to surgery? Is that always the option, or is there ways to manage it where it doesn't feel like it takes over your life as much?
Well, in fact, what we tend to do a lot is we look for every possible option to avoid surgery. Surgery should be your last option, and there's a lot of things that can be done, all kinds of different modalities that we can do, often to prevent surgery.
Well, out there today, many people played sports, and so there's a lot of hip injuries and especially a lot of knee injuries out there. And I think anybody that's played sports a lot has heard once in their lifetime you're going to need hip replacement or you're going to need knee replacement. So how do you know in the scope of your life when is it that's like the absolute must time to finally have that?
Well, the absolute time to have it is when just about everything out there that has been tried, you know, there's nothing more that we can do. But there's a lot of things you can do. For example, there's physical therapy.
Yes.
There's medications. We have something that's called regenerative medicine, where we can actually go in and let your body heal itself with your own body tissues. And we can often avoid having those implants and a lot of those big operations that take place with those big joint replacements.
And those will really knock you off your feet for a while too. So it's good that you can kind of go through everything else before you have to get to that point.
Absolutely, and the large majority of our patients, we're able to do something for them that can avoid those big operations.
Now, joint pain is another big buzzword that you hear a lot these days. Are you guys seeing more people with like the joints, the achy joints?
We see a lot of patients with joint pains because if you think about it, the joint is what holds a lot of the pressure throughout our body, and our bodies are meant to move. The more that you move, and if you hit them and so forth, you get a lot of inflammation in those joints, and so just about any joint in your body can cause that inflammation, and you get pain from just about anywhere there.
Now, one of the things that I've heard over the years is that sometimes weight gain and weight loss can really affect your joints too. Do you find that as well?
Yes, absolutely. If you think about it, again, the joint is what holds that pressure throughout your body. So, you know, if you just imagine having to carry 20 or 30-pound dumbbells with you all the time,
right.
It doesn't take long.
Put some pressure.
It does, absolutely, and that wear and tear after a while can really get to you.
Now, one of the other things that you hear a lot of these days too with people and patients is headaches and migraines, especially migraines. For a lot of people, that can take you out of commission for a whole day. Do you guys have programs in place to deal with those? Absolutely.
In fact, just this morning I saw a patient that's come to me, and she has a history of migraine headaches, and she's had it since age 10. But it was fairly controlled, like once every 2 or 3 months. But what has happened is recently she actually started doing a lot of computer usage and so forth, and ended up getting a lot of muscle spasms, a lot of tension. And so she developed what's called a mixed tension type migraine headache. Now her migraines are 20 times worse. So a lot of times what we can do is take care of other issues that have caused those migraine headaches to get worse,
gotcha.
And bring her back to where she was before.
Makes
so
sense.
And in that situation, she had very tight spasms and so forth. Some minor injections, just superficial in the skin to relieve those spasms. The tension type headaches go away, and the migraine gets much better. All
right, some very good options. Is there one treatment plan that kind of encompasses everything that you guys have found to be fairly successful?
What we find is that every individual is very unique, and we treat every patient as if they're the only person in the world.
And for example, that's good to hear. Yeah.
One of the things that we do that we're very excited about is a field called pharmacogenomics. So pharmacogenomics is actually a science where we actually look at your genetic makeup and determine which medication works best for you. We don't have to guess which one gives you the best pain relief with the fewest side effects. So every one of our patients gets a pharmacogenomics examination to make sure that that's the right medication the first time around.
All right, sounds good. Some very good information out there. Thanks for sharing with us. For more information about Florida Pain Relief Group, head online to floridapainreliefgroup.com, or you can call the number that you see right there on the screen. Studio 10 Live will be right back with more show next.